thank you, Dr. Resneck, for joining us today. Let's get started. I'd like to turn first to COVID. As you know better than anybody else, doctors and other healthcare professionals have been on the front lines fighting this pandemic. And so with that in mind, how have efforts from those who oppose the COVID vaccine or vaccines in general hurt physicians' ability to convince patients to get the COVID vaccines and the boosters? And what strategies have AMA members used to approach this issue with patients who are reluctant or who are being guided by false information?
Well, thank you, Mary Agnes. Thanks for having me, and thanks for the important attention that PolitiFact and Kaiser Health News are putting on this really timely and important topic. You know, it has been a tough 2.5 years, I think, for the profession. And as I look at my colleagues around the country and facing the politicization of this crisis, we've fortunately moved on from a point where people had to be sleeping in garages and tents to protect their families from infection when physicians were coming home from work. But now we really do continue to face these well-coordinated efforts to mislead the public with disinformation. And I think it's contributed to a loss of trust in the advice of experts. Some have even really called this other pandemic of mistrust an infodemic. And I think it probably existed long before COVID, but the polarization that we've seen these last couple of years has really hampered our efforts to respond. Individual physicians are seeing it in their offices, right? When individual patients come in and we're face-to-face with them. Fortunately, most patients still trust their own doctors that they've known and who've taken care of them for years. But individual physicians are having to spend a lot more time talking through the evidence and sort of pushing back on some of the disinformation that patients have experienced. You know, you asked about what we're doing to push back. Well, let me just say, at the individual level, I've really never been prouder of my colleagues in medicine, whether it's people who are in the national limelight who are on traditional media talking about facts and science, or whether it's just individual docs in their communities in social media pushing back on local TV, and again with their patients in their individual exam rooms.
So let's talk about how this may be influencing the whole world of childhood vaccines. Has this anti-COVID vaccine movement hurt physicians' ability to convince parents to vaccinate their kids against childhood diseases? I'm thinking things like polio, chickenpox, or rubella. For years, those were just a standard course of practice. You had a timetable, you go to the pediatrician, you get them done. How has the misinformation around COVID impacted that area?
It's a great question, and I sort of have good news and bad news on that front. And the good news is that unlike many other regions around the world, in the US, most kids are still getting their recommended shots. The national rate among kindergartners has declined a little bit from about 95% a couple of years ago to I think 94% in 2021. But it is still an issue of concern. We are seeing, and pediatricians experience this every day, an increasing number of families who are seeking exemptions from vaccine requirements that are not related to health reasons. And I do think misinformation has contributed to that, and things people read on social media have contributed to that public distrust. So it's creating a bit of a fertile ground for outbreaks. We're now seeing in New York polio circulating again, which is sort of unheard of in the current era. There's fortunately only been one paralytic case, but we know from data from monitoring sewers actually that there is polio circulating again in the community. So we worry about managing to continue to keep those vaccination rates up high enough that we don't see more of that.
But for now, it sounds like it hasn't had a serious impact on the rate of child vaccination.
I mean, another piece is just because people weren't seeing their physicians as much during the pandemic, we fell a little bit behind, but fortunately, kids are back in and seeing their pediatricians in person and catching up on their vaccines.
Oh, that's terrific to hear. So I want to talk a little bit about what happens when doctors themselves are the source of medical misinformation. A former KHN colleague of ours, Victoria Knight, wrote about a physician who posted on Twitter that COVID-19 was, quote, a planned operation, close quote, and shared an article on Twitter alleging that most people who got the COVID vaccine would be dead by 2025. Another physician in Ohio testified before state legislators there that the vaccine could cause people to become magnetized, and clips from that hearing went viral on the internet. So it's my understanding that state medical boards and specialty societies are the ones that have the power to investigate and discipline physicians who publicly spread false information. But is there a role for the AMA here? Do you strip them of their membership? Do you call them out publicly?
Well, there is a big role for organized medicine here. And as I step back a minute and think about this, at first, I'm sort of struck by the amount of damage that a small number of people can do. So at first glance, health-related disinformation really seems to be a very fractured entity when you think about social media and the number of accounts. But when you do some deeper analysis, you really recognize that the sources of some of this disinformation are heavily centralized. And there was one study that found that 2/3 of claims that were disinformation around vaccines and COVID could be traced back to 12 individuals nicknamed the Disinformation Dozen. And as you alluded to, a few of them were healthcare professionals, not all of them, but some of them were. And in some ways, this is really deeply disturbing to me when I think about just our medical ethics and what they call on us to do, and actually having members of the profession, although a very small number and a tiny minority, actually doing harm. At the AMA, we in June adopted a really comprehensive strategy to think about how are we going to push back on disinformation and reestablish trust in experts and in science. And one piece of that really is focused on countering voices who spread blatantly false information online or who monetize the spreading of that disinformation. And so one of the things we have called for is to make sure state medical boards and the certifying bodies that certify specialists have the ability to respond swiftly and to take action. And we have worked to protect that ability. Sometimes politicians in some states try to get in the way of state medical boards actually being able to do that. So whether it's, and then yes, we as follow-up can take away AMA membership, but really the state medical boards are in the best position and have the investigatory authority to do this work. And we're not talking about interfering with people's First Amendment rights. We're not talking about the really healthy disagreement about evolving science that is a part of medicine and happens in our journals and other places all the time. We're talking about things that are clearly known to be false and that people continue to put out in social media or other venues.
Are there particular instances where those state licensing medical boards have in fact acted against a physician that provided misinformation, or has the AMA moved to exercise this new power that you just discussed?
We have seen state medical boards taking actions. And again, these are fortunately infrequent because it's really a small number of physicians and other healthcare providers who are responsible for this. So it's really just tiny numbers at the margin, but because those people can do so much harm, we have, and some of it has been around putting forth false treatments for COVID or saying things that are just blatantly false about the vaccines. But we've also seen, unfortunately, threats against not only public health officials, but members of these state medical boards. So we're also speaking up just about the importance of that. That really has to end. This era in which people feel free to make threats or even threats of violence against public health officials or against those who are standing up against this anti-science aggression is really unacceptable.
So you talked earlier a little bit about trust, and you just mentioned the threats that we've written about them here at Kaiser Health News against public health officials and the weakening of some of these local health departments. What is the intersection between COVID and trust? Trust in the physicians, trust in your local or state public health departments, even trust maybe in the school nurse. Has that been eroded because of all of the misinformation around COVID? If that's the case, how do you get it back?
I think it has eroded a little bit. And I think a lot of my fellow physicians are really feeling this in our interactions. And again, we went from this period at the beginning of the pandemic where people were out banging pots and pans to celebrate the work that physicians were doing to an era again where we have threats of violence and this degree of mistrust. So there are a lot of parts to the comprehensive strategy that we at the American Medical Association are putting forward. It's gonna take a lot of work to rebuild that trust. Some of what we're doing is educating health professionals and the public on really how to recognize disinformation and how it spreads. We recently worked with a nonpartisan nonprofit called the News Literacy Project to create a free online lesson called Be Health Informed. This one's really aimed at teachers and students and the public to be better and more critical consumers of medical information, and kind of gives them clues on how to spot red flags about what might be misinformation online. We also really think we need to rebuild our public health infrastructure in this country. I am worried about sort of the next pandemic or the next emergency, and making sure that we have both the trust and experts in science in place that we need, but also the public health infrastructure. We lost a lot of public health officials who were either pushed out of their jobs or quit under difficult circumstances over these last 2.5 years. It's really important that we reinvest in data infrastructure and in the people who do that uncelebrated work of protecting our public health so that we're ready in the future.
What can the AMA do to help make sure that happens? Because as you've noted, we've got public health departments at the state and local level that have definitely lost funding due to the threats we talked about a moment ago. They've lost some very key personnel, and we may have other pandemics on the horizon. So what actions can the AMA take to that point?
Well, we're building on our relationships that are longstanding. We have part of what we do is interface with policymakers, whether it's federally at the congressional level, in the administration, at the Department of Health and Human Services. And we also partner with state medical associations around the country, and together have really strong relationships with state governments and state government leadership. So we're working really hard to explain to everybody that we encounter and everybody that we convene the importance of this. So part of it is just using our credibility to make sure people understand the importance of that. And also just continuing to make sure evidence-based information is accessible. Part of the American Medical Association is JAMA, a journal that people probably recognize from big articles in the news all the time, and a whole JAMA network of specialty journals. We've gotten very good at evaluating new information quickly and getting things out there and creating formats that are both for physicians and other health professionals and for the public. Trying to get more evidence-based information out there.
Right. Well, we'll watch that space because I think it's a real important one. And I'd like to shift to another important topic when we talk about healthcare information and potentially misinformation, and that's over abortion. As we know, the Supreme Court's recent decision to overturn Roe v. Wade has impacted physicians' interactions with their patients when it comes to reproductive health. And this decision gave states the power to decide if they want to allow abortion or not, and if so, under what circumstances. But in July, the Department of Health and Human Services reaffirmed that a federal law that is known as EMTALA requires hospitals and physicians to offer life or health-saving medical services, and that includes abortion, in emergency situations. Now, there's tension between the federal guidance and the laws in some states restricting abortion, and doctors are caught right in the middle. How are you navigating this tension?
It's a really important question, and I'm glad you asked about it. Let me just first say where our AMA policy comes from. And it's not just Jack Resneck deciding or our board of trustees deciding. We actually convene the whole House of Medicine a couple of times a year for a week, and physicians from every specialty in every part of the country, in urban and rural areas and red states and blue states, come together and have science and evidence-based debate about what our policy is going to be and vote on it, and minds actually get changed. And so that House of Delegates has consistently for years spoken up that issues like comprehensive access to comprehensive reproductive health care should really be between physicians and patients, and that politicians don't belong inserting themselves into exam rooms. And so we're quite troubled by what we're seeing in a lot of states who, in the wake of Dobbs, are implementing, in some cases, 100-year-old laws related to abortion, and in some cases making new ones. And we're frankly seeing chaos in some of these states where physicians are being placed in incredibly difficult positions. On the one hand, to uphold their ethical duty to take care of the patient who's in front of them, and on the other hand, trying to comply with these webs of complex and restrictive state laws. You mentioned EMTALA. So that's a law, again, that essentially says to an emergency physician, hey, the patient who's right in front of you who's unstable or at risk of dying, you have to take care of them, regardless of their insurance or anything else, that person who's right in front of you. And sure enough, we're seeing patients with ectopic pregnancies at risk of dying, patients with complicated miscarriages who have bloodstream infections or hemorrhage or other things, where physicians are literally having to call hospital attorneys to say, hey, I think this patient's at grave risk. The only way to take care of them is to terminate this pregnancy. And hospital attorneys are saying things back like, well, what are the odds of death? And if a physician says, I don't know, maybe 25% right now, the physician is hearing back, well, when you think it's 50%, call me back, and then I think you can move ahead. That's just outrageous and so dangerous for the practice of medicine and for the patients that we take care of every day. And getting back to sort of how this ties in with disinformation, we are seeing this anti-science aggression and disinformation used by forces to counter even our efforts to bring truth to what's happening. And so people are saying in the news media, for example, hey, those instances are actually quite uncommon, when we know that ectopics are 1 to 2% of pregnancies, miscarriages are even more common. So anti-science aggression is really being used to widen existing divisions on a lot of issues. Abortion is one of them. Gender-affirming care, similarly disinformation about what physicians are doing to take care of transgender teenagers in states across the country, and disinformation being used to pass very restrictive laws on that front as well. So these are other areas where we are worried about facts not being used appropriately and ending up harming patients.
If you to dive a little deeper, if you are a physician in this particular circumstance that you mentioned, and you've got to go through the hospital legal department, and you present the patient's circumstances, and perhaps that legal counsel says, well, you know, it's got to get a little worse, or we need to see this marker or that marker before you can perform the abortion or the other service that you need to do, which may or may not be allowed by state law. I mean, what do you as a physician do when you're bound by ethics to take care of the patient?
This, again, physicians are being put in incredibly difficult positions, and these are cases where sometimes minutes matter. And so, you know, we can't advise physicians to break the law, because a lot of these laws hold physicians up for felony offenses where they can actually go to prison, lose their medical licenses and their ability to take care of all their other patients. But we also understand the overwhelming desire and need to take care of this patient who's in front of you. It's what we do as physicians. It turns out healthcare is really complicated and not something simple that like fits with things that you can enshrine in very specific statutes. And that complication is why a lot of us were drawn to medicine in the first place. If it was simple and cookbook, it wouldn't be as interesting. And so we sit down and evaluate individual situations with our patients every day and talk to patients about the values that they bring to that conversation and their wishes, and put all that together with shared decision-making to come up with a plan. And again, the notion that you have a governor or a state legislator or an attorney general basically sitting on your shoulder, watching you and judging you in the exam room when you are trying your best to do what is right for the patient in front of you and respect that patient's desires and wishes is incredibly stressful for the physicians on the front lines and just dangerous. I can't underestimate how dangerous this is for patients.
And I would assume with all these concerns that the AMA is intervening in the legal sphere as well, whether it's filing briefs rather to courts of jurisdiction, lobbying on the issue at state level.
We are. We briefed actually in the Dobbs case itself, and we again really work to bring science and evidence to our briefs in these cases, and have been speaking up on a number of reproductive health cases over the years. Clearly that case didn't go the way we thought it should. We're now engaged in some lawsuits related to EMTALA, the issue that you brought up earlier. We've actually had some success in Idaho with a ruling about the responsibility of emergency physicians to take care of the patients in front of them. And hopefully that will help mitigate and counter some of the very restrictive state laws. But I can't sugarcoat this, because in the past, when states would occasionally make restrictive laws that we thought weren't in patients' best interest, we had the courts as a place to go as a remedy. And the Supreme Court has certainly made that more difficult. We are looking for every other way we can to mitigate the harms and risks to patients. So we worked with the administration and others and litigated. And you mentioned EMTALA. We're also speaking up. It turns out now that a lot of patients who are not even pregnant or in a situation really directly related to reproductive health care or an abortion who are just going to the pharmacy to get a medication for their rheumatoid arthritis or their lupus or their psoriasis or something else, and their prescription happens to be for a drug that also can impact pregnancies or is also used to treat miscarriages. We're now seeing pharmacists actually refuse to dispense those drugs because they're afraid of getting prosecuted in those states as well. So we're seeking ways to make sure patients can get the medications they need, that patients who have the resources and time to travel out of their state to get needed care when their state doesn't allow it can safely transfer to other states to get that care. So a whole host of issues, things people aren't even talking about as much in the media, like medical education. How are we going to train another generation of physicians in these restrictive states, even on basic things like how to manage miscarriages and ectopic pregnancies when the laws are so restrictive in those states? So it's affecting medical students and residents and others as well. So there's a whole breadth of downstream consequences that we are looking at and focusing on at the American Medical Association and really trying to mitigate the harms to our patients.
Okay, so we've got just a few minutes to remaining, but I was very interested to also try to get your take on the medical misinformation horizon. And I don't mean to cast doubt on the future, but are there things that you're worried about? Has the federal government or HHS and public health officials, the lessons learned on messaging, what have they learned that you think that you could take away to counter misinformation in the future? What does the way monkeypox has been handled suggest, perhaps, if there's been lessons learned on COVID that are being applied now?
Yeah, monkeypox is an interesting comparison. I think it's becoming clear we haven't learned all the lessons from COVID in terms of when we look at access to testing and vaccines and therapies for monkeypox, when we look at issues of stigma around communities at risk of monkeypox that we sort of saw with COVID as well. I think in terms of disinformation, a couple of things. I talked earlier about the sort of public health infrastructure and the need to strengthen it. The need to make sure that we actually have trusted experts with the right backgrounds in leadership positions as opposed to political appointees who don't have backgrounds around science and medicine and evidence. Those are important things. I also think that I don't think that the public health infrastructure or physicians as a whole fully knew the science. There's a whole other science of social media communication that is an evolving sort of science of its own. And the purveyors of misinformation took advantage of some of those tools to very, very rapidly spread harmful misinformation and disinformation. And I think we have learned a lot in the last couple of years about how to use those same tools in social media to push back and to get actual truth out there to patients, to the profession, and to others. So that's one thing I'm optimistic about. These are not new battles. I think social media has certainly accelerated how quickly disinformation can be put out there. So that's a new front for this battle. I was looking back at archives and noticed that in 1906, the AMA formed a department. They called it the Propaganda Department at that time. It was later renamed the Bureau of Investigation, but it was all about combating unscrupulous medical claims, sometimes from those with professional credentials. And the AMA created its own lab to test the ingredients of sort of snake oils and patent medications and nostrums at that time. So this is an ongoing battle, and I'm optimistic that we're going to make progress in our efforts to push back on disinformation. But it's a really, really important battle because of the dangers to the health of the nation.
I couldn't agree with you more. We'll be following it at Kaiser Health News. I know you'll be on top of it as well. I want to thank our audience today and also thank Dr. Jack Resneck, President of the American Medical Association, for a terrific conversation. Thank you so much.
Thanks, Mary Agnes. I appreciate it.
Sure.